All right, today is World Heart Day. It's a day created to educate people on different cardiovascular diseases like heart disease and stroke. Heart disease, by the way, one of the leading causes of death here in Oklahoma and the world too, killing more than 18,000 people each year. On this Wellness Wednesday, we are learning about how to take better care of our hearts. We can always do that. And to talk about that today is Dr. Arash Karnama from the Oklahoma Heart Institute right here in Tulsa. So not too far of a drive for you to make over here today. And thank you for being with us today. First off, tell us why this day is so important, especially when it comes to educating people about heart disease and stroke.
Well, for the last 18 months, the world and this state and this city has been dealing with this pandemic and this huge infectious disease issue. But during that time, heart disease didn't stop. Vascular disease didn't stop. And so those folks are coming in trying to be seen in the middle of this pandemic. And so we've seen with each wave of COVID, behind COVID is all the heart disease and vascular disease that, like I said, didn't go away. So
right. And then what are some symptoms we can always be on the lookout for to prevent heart disease?
So the most common symptoms, whether it be men or women, is left-sided chest pain going down the left arm. That's the most common. But we see folks coming in with shortness of breath, nausea, fatigue, tiredness, all those things. And by and large, the thing that I would recommend for folks is to not ignore symptoms. That's the key factor.
Because those symptoms, like you mentioned, those mirror a lot of different health things.
Absolutely.
And I know a lot of people will put that off and then not get the help that they need. So those symptoms, go see a primary care doctor, do you think, and then get referred to a cardiologist? Or would you say, can you get in with a cardiologist if you're having those symptoms?
I think to seek medical care where it's convenient for you, close to you, and those folks are trained to pick up on those subtle things. And every year we see folks coming in with heart attacks, and when you ask them, they say, well, 2 weeks before that I had fatigue, tiredness. 3 weeks before that I had a little discomfort. I thought it was indigestion or something like that.
Right.
So.
What's the typical age of someone that has heart disease?
So in men over the age of 40, depending on risk factors, and that's key as well.
Okay.
If you're somebody who's diabetic and has any symptoms, those should be checked out. Smokers, people with a family history, those are very important things.
Okay, and then finally, as we wrap up here, what can we all do to keep our hearts healthy and try and prevent this from happening?
So the big things I would suggest would be to keep active, to eat well, to eat a very balanced and heart-healthy diet, know your risk factors. Go and invest in a blood pressure cuff to know what your blood pressure is, check your cholesterol, see your family physician, get your regular physical exams. And those are the things that I think are important.
Okay, and checking cholesterol, should that be a yearly thing along with the physical?
Absolutely.
Okay.
Absolutely.
All right, Dr. Karnama, thank you so much for your time. We appreciate you stopping by this afternoon. Brian, Stacia, we'll send it back over to you.